Hi there, welcome to Studio B. My name's Natasha. If you're new here, I'll be uploading exercise videos and strategies to help you get through your breast cancer journey. So if that's something you may be interested in, make sure you hit subscribe and hit the bell so you get notified every time I post a new video. This exercise routine is recommended for patients up to 2 weeks after surgery. However, depending on the type of surgery you have, these exercises might be achieved earlier on in your recovery. It is encouraged to start these exercises as soon as possible as they are the first step in your physical recovery and will help restore the movement and muscle strength in your shoulder, shoulder blade and upper torso, which are commonly restricted after breast surgery. Different types of breast surgery affect strength and flexibility in different ways, so you should discuss with your surgeon how your surgery will affect you and what exercises are best for you. These exercises are targeted towards lumpectomies and mastectomies with or without a sentinel lymph node biopsy or axillary lymph node dissection. The mastectomy may or may not include an expander or implant reconstruction. The difference between a sentinel lymph node biopsy and an axillary lymph node dissection is that a sentinel node biopsy involves removing the first lymph node or nodes in the armpit to which cancer cells are likely to spread from the breast. These nodes are then checked for signs of cancer, while an axillary lymph node dissection is a more extensive procedure where the majority of lymph nodes are removed from the armpit and examined for signs of cancer. Patients who have an axillary lymph node dissection will usually have a draining after surgery, whereas those who have a sentinel node biopsy normally don't have a drain in place. With this type of surgery, it is encouraged to move your arm as tolerated or as limited by your drain. Similarly, if you have a lumpectomy or mastectomy, your movement is usually not restricted. However, if you've had a mastectomy with an expander or implant reconstruction, you will often be advised that moving your arm up and out to the side should be limited to 90 degrees. The duration of this limitation is guided by your surgeon as noted in your operative report. I will be uploading a video specific for flap reconstructions as the post-op exercises and timeframes for this type of surgery can be a little different. So please stay tuned. It is recommended to do small amounts of exercises more often than one big session of exercise. Repeat every exercise 10 times and at regular intervals, at least twice a day. If you have been prescribed pain medication after your surgery, it is best to do these exercises at least 20 minutes after taking it. None of these exercises should affect or pull on your drains or stitches. However, if they happen to do so, please seek medical assistance. All exercises can be done from either a standing or seated position. Alright, let's get started here. We begin with diaphragm breathing. Position yourself upright. Imagine your spine is a row of building blocks stacked, one on top of the other. Relax your shoulders and open up through your chest. Breathe in through your nose slowly to fill the bottom of your lungs and slowly breathe out through your mouth. You can choose to place your hands at the bottom of your ribs, as I have shown in the video, where you should be able to feel your lungs expand as you take a deep breath in and collapse on the breath out. The next exercise is shoulder shrugs. Simply shrug both of your shoulders as comfortably as you can up towards your ears and then slowly down. Try and be aware of your positioning so that those building blocks stay stacked, your feet are hip-width distance apart and your knees are soft if standing. Imagine you have a double chin to avoid poking your chin out. Now to perform shoulder rolls. Roll your shoulders up and forwards in a circle 10 times. You may notice that closer towards the end of the 10 reps, you may find that you have more movement and it is a little easier to move than when you first started. Now repeat this exercise in reverse by rolling your shoulders up and backwards in a circle. Hand slides up your back. Place the back of your hand on your bottom and slowly slide your hand up towards your head and then slide it back down towards your bottom. Try to relax your shoulders as you do so. Forward wall climb. Stand facing a wall, slowly walk or slide your fingers up the wall and then slowly back down. To make sure you are doing your exercises correctly, you can also do the exercises in front of a mirror. Initially, you will not be able to walk your hands very high. However, over time you will gradually see the improvement. It is important to not push through any pain. Sideways wall climb. And as you can see in the video that I had a furry little helper to encourage me. Stand with your operated arm side onto the wall. Slowly walk or slide your fingers up the wall and then slowly back down. Forward arm lifts with your hands together. Stand with your hands clasped together, shoulders away from your ears and thumbs pointing up towards the ceiling. Lift your arms up as tolerated and then slowly lower them. This exercise can be done either standing or lying down. Shoulder blade squeeze. Slowly squeeze your shoulder blades back and down. You may feel a slight opening through your chest as you do so. Hold for 2 to 3 seconds and then release. Please find a list of the exercises up on your screen. It is important to only do the number of exercises that feels right for you at any given time. You may find that some days are better than others, and that is completely normal. You should gradually see an improvement over time with your strength and flexibility. Once you can do these exercises, try the next progression of exercises. You will find this video on my YouTube channel at Studio B Health and Wellness. I hope you liked this video. If you did, make sure to let me know by giving this video a thumbs up and hitting subscribe. I'll see you guys soon with another video. Have a great day and remember to be kind to yourself.